I'm going to start this episode of The Call out with one word. It finally happened. I got run over by all kinds of technical issues on this episode. Camera issues, audio, video, editing. A little bit of everything popped up on this one, but I'm trying to make it happen. Dr. Godet and Dr. Eisenman. Awesome clinical neurologists. I think that's what they are. Doing great stuff in the area of rehab and resiliency and mental health. They did a great thing sitting down with us. I kind of made Dr. Godet look like Optimus Prime with some problems on the camera. Hopefully you guys can get through the video if you're watching. If you're just listening, it won't matter. Thanks a lot for sitting in on this. Hope you enjoy it. And let's go. Okay, welcome to the podcast. My name is Eddie Molina. I am the Southeast Regional Manager for the ALERRT program. The ALERRT program is a grant-funded, data-driven training program where we focus on training first responders and military operators in active shooter response, tactical medicine, integrated response with different agencies. We've had the opportunity to go around the country and teach a lot of people, and we're trying to make an impact with this podcast to bring important people with knowledge, with a bigger knowledge base than ours, to come and have an impact on the first responders and military groups around the country or around the world. And that's kind of why you guys are here. Today we're talking to Charlene and Michelle, and I'll let y'all do your introductions here in just a second. But we're going to be talking on the topic of resiliency and brain health, right? Mental health. Cool. So I'll let you all do some introductions. Charlene, you want to start?
Sure. I'm Dr. Charlene Godet here in Dallas, Texas, and I work at Resiliency Brain Health.
Awesome. Michelle.
And I am Dr. Michelle Eisenman, and I also work at Resiliency Brain Health.
Awesome. Well, thank you all both for being here. So I know we have a lot to cover, and I want to just kind of give everybody that's watching or listening the opportunity to kind of get to know who you guys are and why y'all are actually here. So a little bit about where you came from and I guess what drove you in the direction of, I guess, doctor school, right? Yeah, just jump in there and give me a little background on where y'all are from and all that.
Well, I was born and raised in San Juan, Puerto Rico. And what really drove me to this side of healthcare was that I have a really long family history with neurological disorders, everything from peripheral neuropathies to chemo brain to traumatic brain injuries. And I was very motivated to work with this group of people because of my relationship with my grandfather.
So continue on with the story about your grandfather.
Yeah. So my grandfather, he was in the Army, and he suffered a very traumatic accident. He was actually blown up a few feet in the air, landed in a thorn bush, and had to have his arm amputated, actually a thorn went through his eye.
Oh, wow.
And he was rescued in San Antonio. And so a little bit of a history between Puerto Rico and Texas, and now I ended up in Texas. But growing up, I always had a very good, strong connection with him, and he told me a lot of war stories growing up. I'm not sure if many of them were approved for children, but he worked very hard, actually, on the topic of gratitude. He was a very disciplined man, and he unknowingly did his own therapies, and he started doing a lot of work with fine motor movements and painting and focused attention and meditation, and he actually, with one eye, and one thing we know is that eye movements are very important when it comes to brain function, was training himself to have good ocular movement, and so he would read like a 300-page book in a day.
Wow.
And retain all of that information. So I just grew up with a very good person and hero in my life, and I was able to learn a lot from him, and my other family members that have a lot of neurological disorders, and I was very motivated by what it meant to improve function and neurology as it is. I think we all think of neuroscience as being something that you can only address through medication or through surgery, but there's a whole side of neuroscience that relates to function and improvement that I don't think is very well addressed. And so I've accidentally been placed in a lot of moments in my life that I've seen a lot of people that could have used therapies like this.
So that's pretty huge. Was he documenting what he was doing the whole time, or did anybody document that?
No, I don't think he knew. He just had a big family, 5 daughters, took care of many people, and he just knew that he had one mission, and it was to be a good father. And the only best way he knew to be a good father is to have a good mindset and be able to perform and be optimally present with them. Yeah. And he just worked on it all the time. I mean, I sat with him, I reasoned with him through a lot of things that I don't think my young mind understood at the time. Wow. But he was definitely someone to admire until the very last day. He was extremely devoted to his discipline of wanting to stay grateful and always in growth and improvement, always.
Wow, that's pretty huge. That's a great story, and then it's a great lead into just, I guess, to talking about where we're going to go with this program. How about you, Charlene?
Well, I have been in medicine, I think, most of my life. I started in veterinary and then moved into chiropractic and then moved into neuroscience. So it has been something that's intrigued me for many years. I have a very large family, many veterans in my family. And after getting into neuroscience and learning so much and having the opportunity to start really working with veterans with brain injuries, it helps me to better understand some of the friends that I have, which are police and first responders, and several of the family members I have, and some of the behaviors and challenges that they face that I didn't quite understand before. Yeah. So.
Well, that's cool. So, I mean, I want to. There's so many places that I want to go with the recording, with the podcast, and you led in you talking about gratitude, and I want to hit that. But one of the things that stood out to me while you were telling that story about your grandfather is, like, I remember there's a quote, Thomas Edison quote, talks about the medic of the future, or the doctor of the future, will teach people how to heal themselves more than actually healing them.
Absolutely.
Do you find that that's more of a focus now with the medical profession, or do you think that that's something that drives people like yourselves to, I guess, to pursue a career in the medical field?
I think the medical field now, when you and I were younger, right, you went to your doc and he took care of many things, but we've so segmented. Now you go to a doc for your shoulder and a doc for your hand and a doc for this. So we're not looking at the body and the brain as a whole anymore. We're looking at you as segmented pieces. And I think this, push by, our insurance companies for standard of care isn't actually necessarily the most positive thing for all the patients, sure. Right? Everybody is treated the same way, and if you don't respond, then oftentimes the hands are thrown up and said, hey, we don't know what else to do with you. Right. And docs have, really stopped referring, saying, hey, listen, I think somebody over here may be better for you. And it's gotten more to the point where if I can't help you, no one can. So, you're just kind of stuck like this for the rest of your life. And that's the story we hear over and over every day from patients that come in. Wow.
So, yeah, there's so many places to go. Let's talk about the gratitude function. Like, what does gratitude actually do for the brain? Because I know you hit that. And if anybody sits and listens to it or just researches how it impacts the brain, it's not hard to find that there's stuff out there. What are some of the impacts of gratitude on the brain function?
Well, one of the things about gratitude is that wherever you focus your mindset, it's what you're going to perceive as an outcome to. And the best thing about the brain and neuroplasticity, which just means that the brain is able to adapt, is if you focus your mind on gratitude, you actually reinforce pathways in your brain that can help you make better decisions. An area of the brain that is actually involved in gratitude is called the frontal lobe. And so that is our decision-making brain. And so when we do focus on gratitude, we do find that people are able to make better decisions for themselves moving forward. And so that is the connection that I see with gratitude and the brain and neural circuitry and how it applies to daily life. And it seems like such a simple task, but it actually requires a lot of self-discipline, and it actually requires a lot of work to be able to build that neuroplastic change, which has a lot of impact on how you view the world surrounding you.
So explain a little bit more about neuroplasticity, because I mean it's I've heard that term out there, and I know that it means something, but I don't know what it means to. It's to me it seems like if there's plasticity in the brain, that eventually the brain's going to dry out, or we're going to lose plasticity. So what does it actually mean?
So that's exactly it. I think the first time I heard it, I was like, my brain is plastic? What do you mean?
Yeah.
Right? It's never changing? It's hard? What does all of that mean? So neuroplasticity is doing the same thing over and over until a pathway in your brain is built and your brain's like, okay, yeah, I got it. I know exactly what it is you want me to do. So if we go back to infancy, right? We look at a baby and that baby starts with just looking at you. Can't do a whole lot, right? Then they learn to pick up their head, then they learn to turn over, and they go from turning over to trying to stand, and from the stand, with this kind of movement to a walk, right? And then you see them. That's the day you go, okay, there he is. He's walking, right? And so it's not pretty, but it's there.
Yeah.
And he falls and he stands and he falls until he gets it. And we all do that, right? That's neuroplasticity. That baby did the same thing over and over and over until what he was trying to accomplish worked, right? Now, sometimes it's very quick. It can happen in a matter of seconds. Sometimes it takes days, weeks, months, or years. So it's about how does your brain change? How often are you doing what it is, like practicing gratitude, giving versus receiving, right? Are you more, do you feel more gratitude when someone gives you something or when you do something for someone, right? And so the more you're doing, the more you're giving of yourself, then the more your brain produces those neurotransmitters, those chemicals, those hormones that your brain says, okay, I want to do it more. I want to do it more, right? So we may think it's altruistic when in fact the brain hormones are going, no, we want to do it more because we like the way it makes us feel, right?
Okay.
Yeah.
Wow.
And to add to that, I remember the most famous book everyone reads when it comes to this. I really like the definition. It says neuro for neurology, but plastic for plasticine, as in Play-Doh.
Okay.
So moldable, shapeable neuroplasticity.
So with that, I guess with that mindset on it, so it's shapeable. How shapeable is it to remove stuff? Like, can we remove? Obviously, the word that we talk about a lot is trauma, and whether it's psychological trauma or physical trauma, I think it all inflicts. If it's a big physical trauma that still inflicts some sort of psychological problem, right? Is there a way to reprogram to get rid of what it learned or the trauma that it learned?
Mm-hmm. Absolutely. So our brain files things away much like a Rolodex, right? And so you have a traumatic.
You just aging yourself.
I did age myself.
Us. I think that's us, because you and me both know what a Rolodex is.
Okay, I'll keep looking at you then. So your brain, when there's a traumatic incident or any incident, right, it files away what did I see, hear, smell, taste, feel, experience, and all of those things are put on that card and it's filed away. And so the next time you smell, hear, or see something that was involved in that, oftentimes you start to feel that same emotion. So the best, example that I can use is a person that's gone through a car accident, okay? You heard the screeching of the tires. You may or may not have smelled the rubber. You may have smelled the oil. You may have heard other types of noises. Visually, you saw things. And your brain filed all of that together and put it there. And so you're walking down the road, a month, 2 months, a year from now, and you hear screeching tires, and all of a sudden you feel, that heart rate come up, that cortisol starts pumping, you go into fight or flight, you start to smell oil, although there's nothing around, and you start to feel what you felt when you were in that accident or that trauma, right? And so, you're not necessarily going to get rid of the trauma or necessarily always even the memory, but you can take those things and separate it so those are no longer triggers, right? You can smell oil again and not have a negative reaction to it. You can hear a screeching tire and turn and look to see, okay, it's just somebody going around a curve too quickly. So you can pull all of that apart and let your body better respond to those moments.
So what's the process? How do we do that?
There's a lot of different processes. You want to start?
To be able to start with a process like that, I think the very first step is working with a qualified practitioner that can really help assist you in figuring out where your brain is optimally functioning and where it's not optimally functioning. Because I like to call ourselves like brain detectives sometimes, because when we do a neurological examination and some diagnostics, and especially a history, because 80% of what a patient is going through actually comes from the history, as practitioners, we're able to pinpoint out specific areas on, okay, so all of these things are tick marks in this area of the brain, and now we know this area can be rehabbed, and so depending on your unique presentation, you can make a treatment plan that's based for you with therapies that are very non-invasive and then just require some neuroplastic change like that we were talking about, that specific frequency and intensity of activation to be able to rewire those neurons. I think it's important to note that neuroplasticity can be good or bad. So trauma is usually a negative form of neuroplasticity because the brain is formed by all these senses and emotions like Dr. Gaudet was talking about. However, through therapies and really using these functions to better itself, you can actually create positive neuroplasticity to be able to take those triggers, like she was saying, and dismantle them and not have them create a neurological response.
There's a physical, a mental, emotional, and a chemical part to all of this. So it's not just neurotherapies. It's not just medications, supplementation, or that line, and it's not just talk therapy. All three of these are affecting how you respond, right? To everyday life, to any event, right? And so when you're working with people and that have had these types of traumas and PTS and brain injuries and things like this, you have to be able to assess all of those things, which means you need a collection. I mean, there needs to be a group of practitioners that somewhat understand what everybody else is doing and are willing to say, okay, this is my part of it, and this is how I can help, and then I'm going to hand them to you, and this is how you help them in the ways that you help, and then we'll get the next. And so then we're handling every aspect of that person, because there is no one size fits all, and there is no one practitioner that's going to do everything that you need done.
Okay, so I guess what are the some of the top, I guess, well-known therapies that are out there right now? 'Cause I know I've heard of psychedelics. I've heard of the eye movement training. I've heard of a couple of different types of training. What are some of the things that you guys are using, or can you all talk about the methods that you guys are exploring?
Absolutely.
Sure.
So we do a lot of neuro rehab, right? But we work in conjunction with our MDs and our nurse practitioners and psych parts, and they're helping on the chemistry parts, on the psychedelic parts, on the talk therapy. So we're going to prime this brain, and we're going to get those pathways starting to flow. And then the nurse practitioner that we're working with is going to work on the chemistry part and the anti-inflammatory part. And then we have a pharmacy that we work with that does a lot of the compounding if we need, different compounded type medications for that patient. And then we're going to then work with the psych if this person feels like, hey man, I need to talk to some people too. And so they're going to come into the clinic and we're going to look at, how do their eyes track? Your eyes are amazing when you start looking at the brain, right? Your brain has these 12 pericranial nerves on each side, and it takes 6 of those 12 just for the eyes, right? So your eye has a huge representation in your brain. So when we're doing eye testing and eye therapy, we are able to actually stimulate or work with every part of the cortex, because the eyes have something to do with every part of your cortex plus your brainstem, right? So eye therapies are incredibly important, right? We use a magnet, transcranial magnet, right? FDA approved, VA approved for major depression, anxiety, OCD, but it's coming out for so many other things, right? Non-invasive. It's great. If you're on meds, you can use that therapy. If you're not on meds and you don't want to be on meds, you can use that therapy, right? So that's a really nice added, bonus to people that are like, I've tried all these meds and none of them work for me. Great. Here's something non-invasive. Let's see if that helps, right? Then we can do, vestibular therapies, balance, because balance is huge. If a person isn't steady, right, then the chances of them tripping, falling, hitting their head on a cabinet, getting another brain injury, huge, right?
Yep.
So you need to reduce fall risk. Although none of us think about fall risk until we're older, that's our grandparents kind of thing. But fall risk are a big deal after you've had a head injury.
Yeah, absolutely.
Right? The percentage is huge. What else, Doc?
I guess what the focus I want to relay to people is that you have to keep a very dynamic approach to healing. And so I think a lot of people try to really, like she was saying, segment different things, and they get really hyper fixated on like, I must do these things or I must do these things, and just keeping that dynamic ability to be able to say, I need to work on my eyes, and the activation of movement will create a chemical response, and that chemical response can also lead to a past memory as my memory improves, and then I need to speak about that memory and process that, and then continue working on the physical side. And so I think that keeping a dynamic approach to understanding that the brain is going to be working optimally some days, maybe not optimally the other days, really making sure you're taking marks on, okay, how do I feel physically, how do I feel emotionally, how do I feel chemically, how am I feeding myself to, is really important. And so, as she was saying, we really handle the neuro rehab aspect of it for consistent activation, and then other people work with more of the chemical sides of it and then the therapeutic sides of it. But I think she hit it in the nail when it comes to eye movements, the TMS, and the vestibular therapy, and then I would just add the cognitive therapies as well. One of the things we hear often is, I want my memory improved.
Right.
Or I don't feel like I'm as sharp as I used to be. That is a big blow to someone, especially when they've been a very sharp individual and were praised for being a sharp individual. And those are some of the things that we also help with.
So a couple of questions that come out of that, and I'm assuming that if something comes to your place for therapy and you guys start working with them, I'm assuming that you have them documenting everything. It's like you said, it's like what I ate today, how much did I sleep today, how much of an impact do those things make? I mean, if I'm not sleeping enough, because I can speak from the first responder side, working shift work, responding to call outs, doing that type of stuff. You don't get as much sleep, or you don't get as regular a pattern sleep as I guess probably as healthy. Mm-hmm. How important are those types of things?
Sleep is huge. So one of the things that we talk about from day one when somebody comes in is we've got to figure out how to get you to sleep, because the best brain therapy in the world, the best chemical intervention, anti-inflammatory, that, none of it works if you're not sleeping, right? Okay. So we have to figure out what's causing you not to sleep. Is it work-related, or is it perseveration in the brain? Are you laying there having arguments with yourself? Is the conversation that you had with your wife 2 days ago, is that still going over in your head and you're still, going through that? Or is it an event or something you should have said but didn't? And so your brain is just winding up. So it's called a mesencephalic wind up, right? The middle part of your brain is just winding and winding and winding. And so now we're trying to see, okay, if that's it, let's see if can TMS help you? A lot of people, after being on TMS, now they're sleeping again, right? So it's nice because that's a non-invasive therapy, and you're sleeping, and we haven't changed anything else yet. Great. Now we can move into some really good neuro rehab. But if you're not sleeping, pain levels go up, agitation goes up, your filtration system in your brain goes down, you start to say things you don't necessarily mean, you're not able to control yourself like you normally would, your skills aren't sharp. I mean, there's a lot that goes with not sleeping.
So you mentioned something. You mentioned the filtration system, and I laugh at that because people say, "Well, she doesn't have a filter. He doesn't have a filter." Somebody was telling me recently, it's like, yeah, this friend of theirs had been in an accident, a car accident, and after that, their filters were gone. Like they said things that they never said before, behaved the way they didn't behave before. Is that real? Like how real is that?
Very real. It is very real.
So how do we change that, or can we regain those filters, or do those filters, can we regain, I guess, in importance?
Yeah, absolutely. I think it's important to note that after any injury, what happens to the brain is you have a lot of inflammation. There's a lot of a massive immune response that happens in the brain. And so the best way that I like to talk to people about this is as if you took all these, like you see that right there, there's a lot of wires connected in there, and it's like the wires were unplugged and they're starting to get plugged in. Some fall into the correct category of where they're supposed to be plugged in. Some are not in the correct category of where they're supposed to be plugged in. And so things aren't as they seem. It's very difficult to note with some people because you appear normal, but then your behavior and your functioning isn't normal. And so that is a very big response that happens after a brain injury, is not being able to have that filter or not being able to have that stop and go mechanism to be able to say, yes, I will actually say this, or no, I won't say this. I'll say it in my head and I can think about it. But those are all things that those are all functions that can be regained. Doesn't necessarily, some people, it's very person dependent. Environmental factors, lifestyle factors, like sleep, those are foundational. I mean, taking care of yourself is not optional, it's a requirement. It's like we know that if we don't put gas in a car, it's not going to run. If you don't take care of yourself, you're not going to function. So, and a lot of people think of it as optional. Like, oh, I can sleep whatever, or I can eat whatever, or I can think whatever, or I can move however, and those aren't options. But, all of those things are going to really help determine the speed at which you recover. It can be very, very quickly, like she said, in neuroplasticity, or it can take, a few months or years to be able to regain some of those filters.
Sure. And so I noticed through the years, I get less sleep, and having certain amounts. So like right now, if I get 4 or 5 hours of sleep, that's about average. But Sunday through Thursday, by Thursday it's starting to hit me, and Thursday I'll sleep late, or Friday I'll sleep a little bit late. But I definitely feel the recharge on that one long day of sleep. Is it real, or is it fairly common that different people can function on different amounts of sleep? And what shows in that? Because you were talking about what people are intaking, what's their dietary intake, how am I feeding myself that day? Do you see a difference? Is there a bigger clientele out of different social groups? Because like we grew up fairly like lower middle income, so we ate like probably not the healthiest diet. I know I didn't. I was a fat kid, and I'm not going to show any pictures. But yeah, I was the fat kid growing up, and that's just the way we ate because that's what we could afford. I know in Puerto Rico, you all eat a lot of different stuff, and island food is great food.
Good stuff.
Yes, it is good stuff. Surprised you didn't bring anything with us. That's one thing I noticed about Puerto Rican people. They always have good food close by, and that's a good quality. But yeah, it's like, is there a different response from different social groups or different economic groups?
Yeah.
There is. A lot of things that people think are genetic is actually a learned behavior from your family, right?
Yeah.
It's actually more environmental than it is truly genetics, right? And so we do learn to eat from how we were raised. However, we do get to a point in our life where we get to look around and say, okay, wait a minute, this isn't necessarily the best thing. Everybody in my family is overweight. should I continue with what I'm doing? Is this truly genetics? Is this not genetics? So as we become adults, we do have that the ability to change. One of the things that we spend a lot of time doing with anyone that comes to the clinic is education, right? I'm going to help you attain the goals that you set on day one when you came here, because that's the first thing I ask. What is it that you want to get out of this? Because I need to make sure that your goals are something that I can help you with, right? If you come in and you have a spinal cord paralysis and asking me to help you walk, chances are that's not going to happen in a 2-week time frame. So I need to make sure the goals are attainable. But I also need to know that you're setting these realistic goals. We're going to get you there, but there are things that we're going to expect out of you. Sleep is one of them. Food is another one. Now, inevitably, veterans, first responders, y'all try it, right? I tell you, eat every day before you come in here, because brain therapy is like you going back to high school and doing the hardest subject for 8 hours. Your brain's tired, right? And if you come in here with no food, I'm going to blow you out. I mean, your brain is going to be done in about 30 minutes, and you're going to be dragging ass, and I'm going to be looking at you going, you didn't eat anything for breakfast, did you, right? And so it's not hard to tell. So food, you have to give your brain nutrition, right? It has to be something beneficial, because you either feed it or kill it, right? So you're either anti-inflammatory eating or you're inflammatory eating. And if your brain is already in a state of injury, it's already high inflammation, and you're just giving it more, you're not going to get out of it what you need, right? You're not going to get clarity of thought. You're not going to get better sleep. So when you're young and you don't have that choice, it is socioeconomic, right? But when you're an adult, there are ways that you can make better choices. And at some point, if your brain is important to you, you're going to make those choices, right? I'm going to give you a list. I'm going to show you, okay, these are things that I need you consuming every day while you're in here. But you're going to spend one day and you're not going to, because you're going to want to see. It doesn't make a difference.
Yeah.
And you're going to see it does. And then we're going to get back on track the next day.
So, talking about nutrition, man, I've tried, I think growing up in I guess in the operator environment, we all push each other, and it's all about performance. And man, you're slowing down, you're getting old, you couldn't get over the bar, you're too fat, you're this, you're that. And we've all done different things. Like I said, I grew up the fat kid, so I was real self-conscious about that type of deal. So there's tons of the low carb diet, the high carb diet, the low fat diet, the high fat diet, and there's so many different ways. I'm not going to bother putting the names of them out there, because there's so many of them, and they all work. I mean, they all work. The blood type diet, it's like if you do it, you change things up, they're all going to have a response. Mm-hmm. Do you find that there's a particular type of diet or particular type of food that your brain needs to function better?
Everybody has something a little different. Blood type, environment, things like that. It does play a role into it, right? And there is an anti-inflammatory lifestyle, right? We've gotten a lifestyle of convenience, and that's generally not what you need for your brain.
Yeah.
Those are generally foods that are more pro-inflammatory, right? And so we want to move people into things that...
So you're talking about anti-inflammatory lifestyle, and are you talking about overall inflammation, or are we looking at strictly the inflammation on the brain?
Everywhere, right?
Really?
There's something called the brain-gut axis. So you can't just target the brain, right? If your gut is inflamed, your brain is inflamed. If your brain is inflamed, so is your gut, right? So GI is a huge issue with anyone that has any type of brain issues, brain traumas. So one of the things that we handle, from day one is we start talking about food, right? You got to sleep, you got to eat. There's a reason for this. So if you just kind of take it back and go, if you can grow it, or if you can hunt, right? Those are foods, right? If it comes in a box, chances are it's a little more pro-inflammatory. And for a period of time, you probably need to stay away from this and need to go back to this, right? And so, in my opinion, you shouldn't be eating the same thing in January that you're eating in August. If you're eating seasonal foods, not things that are hothouse, not things, bananas aren't in season all year long. You shouldn't be eating bananas.
Puerto Rico, they are.
So, and if you're in Puerto Rico, it's different. Yeah. So if you really know where your history is from, you know where your families are from, right? And you look back, okay, what's in season for this time of the year for where I'm from, right? And you start eating that, you'll find that it is a more anti-inflammatory lifestyle.
Wow.
So no, everyone shouldn't be eating the same diet. We're not all from the same place. We don't all have the same genetics, right? And so in December, you should be eating things differently than what you eat in March, right? And in March, you should be different than what you're doing in July. And so you're rotating foods and you don't build up sensitivities that way. Your body has a chance to process things going through and you get a variety in your life. You're not bored.
Wow, that's huge. So, Supreme Commander for the day, how do you change up the MREs that are going overseas with the guys? Because, I mean, I know you all are treating a lot of veterans, and it's hard to do that. It's hard to feed them when they're over there. But how big of a change do those MREs need to take on?
Yeah. They're not made for anybody's health.
Mm-hmm.
They're made to give you some energy and to, the bare minimum to keep you where you need to go, but they're not healthy for your brain. They're not healthy for your body, but they get you where you need to be at the time.
Huh. So for a while, I was doing distance events. I was doing triathlons and marathons and that type of work. And I know that there was a company out there, and I can't remember the name of it, but a lot of the athletes were going to this company because they were sending in maybe, I don't know if it was blood samples or spit samples or what it was, or they had somebody measuring your electrolytes, and they were customizing an electrolyte drink for you for your long events. Do those things work for real? And is that something that you would say like we'd have to look at like for an operator overseas or even an operator here on the streets? Would you say customizing meals or customizing drinks like that is very important for them?
If possible, I think it'd be huge.
Yeah, but I definitely think that. But I think that as a rule of thumb to anyone that may be listening and is trying to, well, what's for me? What's for me? Like, biggest rule of thumb is make sure that what you're eating is either inflammatory or anti-inflammatory. And the good news for you is that if it is anti-inflammatory, that has a whole body effect. So that's a plus on that side too.
Yeah.
It's just, I mean, I don't know that it's realistic to be able to design food when the guys are going over, right?
Yeah.
I mean, that would logistically, I can't even imagine how that would. But if you're here and you have the ability to do those things, I think it would be great, right?
Okay, so high carb versus low carb is not as important as inflammatory versus anti-inflammatory. Okay, that's big. Is there a source out there that we can look at? Like, say, I can look at what's inflammatory foods and anti-inflammatory foods?
Yeah, I mean, these days there are probably 1,000 books on inflammatory, anti-inflammatory. You mentioned blood type diet. That's one you can look at.
Okay.
So there are a lot of different ones. But you need different things at different points in your life, right? Your requirements today are very different than when you were in your 20s, right? Your body changes, your requirements change. And so here again, these things should be dynamic. They should be moving with you as we change what we're doing in life, right? If I go from a very athletic type job, and then now I'm working at a desk, huge changes, right? I'm going to need a lot more, vitamin D. I'm going to need a lot more greens in my diet for, the mineral aspects of things. I mean, there are different changes for different states in your life.
Okay, so we talked we talked some about the sleep, some about the nutrition aspects of what we deal with, what humans deal with, and how it affects their brains. But I want to go back to talking about the trauma impacts and what those things are. We talked a little bit. You said if you don't mind telling the story about your police officer friend and what you saw. Like, I can tell story after story after story. I spent 25 years as a police officer. And half of my career was spent on a special operations team, and we got to see a lot of like just stuff that people talk about in stories and people talk about you see in movies about. Maybe share that story that you shared with me earlier and talk a little bit about the impact of those types of events on the brain.
So I have a friend that works for the police force down near San Antonio, and we were hanging out one day and he'd gone out on a call, and it was for a non-responsive infant. And when he actually arrived, the parent, who was under the influence, had actually passed out and was holding a bottle in the infant's mouth. But the baby was so young and so small that he couldn't get away from the bottle, and he actually drowned on milk. And that young man came home, and just watching everything inside of him of having to, he came home and looked at his 2 kids. You know, he has 2 sons, and this was the baby was a boy. And he looked at them, and there was a huge emotional response, and he was trying to figure out how to, 1, process everything that he had been through that day, yet 2, still be a member of his family, and how to, how did he not take that out on anyone else, especially the person at the house that was holding the bottle, and then reacclimate into daily life in just that short drive home. And then, the kids they need attention. Hey, Dad, we need to do this, and we need to do this. And so just watching that moment, or those moments of him trying to figure out how to do that, gave me a much better understanding of several of my relatives that are veterans, and watching them process when they came home, the things that they were trying to deal with but couldn't figure out how to deal with. And there's not always the best support, because the people at home don't understand what you went through. You don't necessarily want to talk to them about all the negative things that you saw or had to deal with when you were, on duty that day. And so it was very interesting to me to see this. And so then if we start to look at the chemical side of this person's in fight or flight all the time, right? He's living on cortisol, right? Cortisol is that stress hormone. And stress hormones aren't all bad, right? We have to have them. It also wakes us up every day. Cortisol is a good hormone, right? It helps us make all of our estrogens and testosterones and DHEAs, and as well as our anti-inflammatory for our vascular system. So, I mean, these hormones are good, but if you live on them, right, they have an opposite effect in the body. So there should be this balance, and there's not. And so if you're living on cortisol all day long, then you're elevating blood sugar too, because cortisol doesn't elevate unless blood sugar elevates with it, right? Cortisol opens your eyes, blood sugar moves the muscles to get you out of bed. So somebody that's living high on cortisol is living high on blood sugar, and now they're moving into a state of being diabetic or pre-diabetic. So now we know you're incredibly inflamed. Now your brain and your body's inflamed just from living in fight or flight. Well, you guys go overseas and you spend 1 tour, 2 tours, 6 tours, right? That's fight or flight the whole time you're there. You are bumping cortisol, and it feels good for you to bump it. You enjoy it, right? You get to a point where you don't know how to live outside of fight or flight, and it actually starts to scare you, right? And so trying to get your hormones back in check. And when we say hormones, we talk about brain hormones are known as neurotransmitters. Digestive hormones are known as enzymes, reproductive hormones. Your body is one big hormone, and it's producing all over all the time, right? And so one affects the other, and this is how we get, when we see, the veterans and the first responders come in, you guys are so high and so bumping cortisol, you've pushed everything else down. Because your body's like, listen, I have this much. I can make this, this, or this, or I can just do this. And so you guys are bumping over here and you're making none of this. Well, a brain that's been injured, especially for a male, will not heal if you don't have testosterone. So now cortisol's high, testosterone's low. In practice, many practitioners go, okay, well, we'll just give you a little testosterone. Well, now you're not actually utilizing that testosterone. It's turning into estrogen. So your testosterone is still going down, your estrogen's going up, and you're still living on cortisol. So we have this whole, dynamic of hormones that have just gone insane. And yeah.
Okay, so yeah, and that's a big thing. So everybody's out there taking testosterone therapy, and everybody's getting testosterone shots and pumping that into their system. So is there a way to do that in a healthy way? Is the process different? And obviously, I won't bash any particular company or any particular group, but are they all the same?
There are definitely healthy ways to go about that. Again, I think it just means working with a practitioner that is cognizant of your goals and understands how to read the biochemistry portion of it and understands how to read a lab and explain it to you as well, which is the education part that comes into it, so that you know how your body is utilizing its resources. The body just you give it resources, and it just, depending on what you're doing, how you activate, it shunts those resources to different places. And so the more that your activity resembles your healing journey, and the more that you work with a practitioner that can help you identify how those resources are being allocated, you can definitely do all of that in a very healthy and safe way.
Okay.
I think most of you guys, you go and you find places to give you testosterone because somebody said, "Hey, man, I think your testosterone's low." That's probably why you're crying. I call it crying at cat commercials,
Yeah.
right? You see this commercial and you're like, "Why am I crying?" And you're shaking your head, which then makes you mad and frustrates you, which then bumps up your cortisol. So you
Sure.
start going through this, and so your brain needs that testosterone to heal, right? You guys, most guys aren't thinking, "Okay, I need this for my brain to heal." They bump it because they need to feel that again, right? They need to feel like themselves. And so if it's done appropriately and you're like, "Hey, yeah, you do need some, but we're going to have to balance it out with this and this and this so we don't knock that balance off," then I think you can do it in a very healthy way, right? There are definite ways to do it. I don't think all places right now that are offering it are necessarily doing the best job that they can do to make sure you stay balanced.
Sure. So does the testosterone have the same impact on females?
Women absolutely need testosterone, but interesting enough, when a female gets a brain injury, they produce high test, low estrogen.
Mm-hmm.
Oftentimes, when men
Wow.
have a brain injury, they produce high estrogen, low test.
Mm-hmm.
So these women come in with, we don't generally care as much, and I say we because I've had many head traumas and I've actually been through a neuro rehab program twice now. So I was a patient before I was a doctor in neuroscience, okay? But I cared a whole lot less about the fact that I was aggressive, and I cared a whole lot more about the fact that I was growing facial hair, right?
Yeah, absolutely.
That's going to get me in real quick.
Huh.
So
That's interesting.
Yeah.
Yeah, that's great info. So we talk about that, and especially talking from the first responder side and the military side, everybody focuses on one versus the other, but they are both the same. There's going to have that testosterone response, estrogen response, going to affect both sexes. So okay, so we've talked a lot about that. We talked some about the gratitude portion of it and the reprogramming stuff. So if the reprogramming stuff is so impactful and it works so well, and everything I've read, everything I've heard, man, it works great. And I know that you guys deal with a lot of different programs. If we can reprogram the brain. So I went through a divorce. I went through a divorce after 21 years of marriage, and it was a tough marriage. But is there stuff that we can do to maybe educate the marriage counselors out there to help them, I guess, with what they're doing, with their missions? Because we have therapists now. I mean, everybody's talking about therapy. So we have therapists out there that are working with the cops and the military guys throughout their careers. And obviously I think first responders keep marriage counselors employed around the country. Is there stuff that we can do to help impact their job?
Absolutely. We actually were had the opportunity to speak to a group of counselors not too long ago for that exact reason, because they wanted to see, and they were financial counselors, not actually marriage counselors, but they wanted to see, what should we be looking at? Because we're seeing some challenges with the veterans coming in. It was a veteran financial lending group, and they're like, we're seeing these challenges. So we had the opportunity to sit and say, hey, these are some of the things that you need to look out for, because this is a person dealing with either PTS or TBI, and maybe at this point you refer them to, somebody that can help them with therapy, so then that they can make better financial decisions. Same thing with marriage counselors.
Mm-hmm.
I mean, if you have a counselor who is dealing with, a first responder or a veteran, and they come in and the spouse is there and something is just not making sense, right? There's something that you're going, okay, wait a minute, there's something else here. That may be the time to start asking a few of those questions. Did you serve in the military? How long were you there? Or, what is your daily job? And, could there be a possibility that there's been some other traumas or other injuries, and that they may need to say, hey, listen, you know what, there's this great center that I think would be beneficial for you to check into,
Mm-hmm.
right? And so they can, just knowing some of those, knowing what your profession is will help them to know that there may be some underlying here, that it's not what they're looking at on the surface, right?
Okay.
Then you're looking a lot more at that referral system that practitioners should have.
Yeah.
It's just enough knowledge to say, hey, you could also benefit from that.
Do you find that there's been a lot of, and we talk about segmenting different treatments along the way. Do you find that that's been the case in the fields, in the neuro fields and the medical fields, that you guys didn't work together before?
Yes.
Yeah. Is that one of your biggest obstacles? It seems like that would be
It is.
probably the biggest obstacle.
It's the biggest
Yeah.
frustration too.
Yeah.
Because there are TMS clinics, and that's the only therapy they do. And you go every day, 5 days a week for 4 to 6 weeks. And at the end of it, they're like, okay. But that's not okay. That's one area, right? And the brain is complex. There's not one therapy that's going to help everybody, right? That's what a neuro exam is about. It's extensive. It's long. It takes about an hour to do an actual exam, and go, okay, these are all the things that we're finding. Let's do some additional testing. So this isn't the 5-minute, let me shine a light in your eye and walk away. This is, no, I really need to see what's going on, right? And then once we see these things, we're like, okay, yeah, these are some of the deficits that you're experiencing. These are some of the goals that you have. I can help you with this part. This practitioner, I think, can help you with this. This practitioner can help with this. Let's get it all together. Let's put a plan together, all of us, and then let's get you started.
And can you switch? I mean, if they're doing the magnets and the magnets are working, but maybe we switch them over to the eye movement therapy, are those therapies still impactful? Can you
It's
switch
not
from
even
one to the other?
switching. It's congruently doing them all.
Oh, really?
Oh, yeah. So in a day in neurotherapy, say if you come, you're in a clinic like we are, you come in, you're going to spend about 2 or 2.5 hours in that clinic, right? You're going to spend 2.5 hours with us doing different therapies. And as we see your brain going, okay, yeah, I got that, we move you to the next one. And your brain says, okay, we got that, we're going to move you to the next one. And we're going to do this until your brain is functioning like it's supposed to, right? So it's not about that one therapy, this, just talk therapy. It's not about just TMS. It's not about just vestibular. You have to be able to do all of these things, because if that's what the deficits you found during that you need to be dealing with all of them.
Okay. So, all right. So, reprogramming the brain. If I need to learn how to shut out something bad that I've gone through, or I need to learn to shut out, you and me have had arguments along the way, and we need to work together, and I need to learn how to keep that away from us so that we can actually have a constructive profession, and we can actually have a good practice together. What are some of the things that or do you teach? How do I get rid of some of that stuff from my brain? Because if I can't work with Charlene because whatever, she stole my Skittles, and I can't get over that, right? I love Skittles. And if I can't get over that, how do I reprogram myself to not think about Skittles when I think about Charlene? It's like, how do I get through that?
That's a really great question, actually. I think one of the main obstacles with that a lot of people see is there is an aspect of impulsivity, and I'm going to bring it again like a broken record. It's that stop and go mechanism of being able to say, yes, I will act upon this. No, I will not act upon this. And as you work on rehabbing that frontal lobe specific area of the brain, that does give you a lot more of a time sequence for you to thoughtfully think through and say how you want to respond to something like that. Now, the therapies that you do for that frontal lobe can be very different. It's not necessarily putting you in front of Charlene and putting the Skittles and doing a desensitization therapy of some sort, but it is really activating that area of the brain that is in charge of that. And so I think that that example that you just used is a source of frustration for a lot of this community, because they relate their inability to not be impulsive to be a willpower issue. I just don't have the willpower to be able to say no, or I don't have the willpower to have a filter. When in reality, it's not a willpower issue, it's a systems issue. It's like you just don't have systems in play in your life right now to help you activate areas of your brain that can help you make those decisions. And so that goes a lot with relationships with people. That goes a lot with food choices as well, because as Dr. Day was talking about cortisol, sugar. Everyone has something in relation to sugar when it comes to a brain injury. A lot of the times we say at the clinic, you may drink it, you may eat it in sweets or carbohydrates. And so some of that is not necessarily a willpower issue as much as we need to activate this area of the brain in rehab. That's where a qualified professional comes in that's able to, keep you accountable and move that needle in that direction to give you more autonomy and power to be able to make those decisions.
So it goes back to that filter that we were talking about earlier,
Mm-hmm.
right? So if that frontal lobe isn't working, that I want lobe,
Yep.
it is working. And it says, I want it now, right? And that frontal lobe is supposed to say, yeah, I know you want it, but is it a good idea? That's the mom part of the brain, right? So we have all of these excitatory areas right there, and this one is supposed to inhibit and calm things down a bit and say, probably not a good idea to do 120 on the highway with the police officer sitting on the side of the road,
Yeah.
right? But if that frontal lobe isn't working, then you bypass, and then you know what comes after that. So it's one of those things where we all have the I want, but if we've had an injury, the but should you isn't always there. And that is where the frustration comes in. Mm-hmm. You go, well, I just don't have the willpower. Man, I don't know why. I used to have great willpower. It's not about willpower. It's about the fact that your frontal lobe isn't engaging like it's supposed to. And it's a common area if someone's had an injury for it to have been injured. So you feel like, so then that brings in all of that emotional parts that you're like, why can't I just control myself now? Why can't I just do this? Well, you can't because there's an injury there, right? But it doesn't mean it has to be there forever. It means that we can stimulate those areas and get them functioning again. And then you will have better willpower. Now, you're still going to have to then start to make some decisions, right? It's not like it's magic or anything. But if we get that frontal lobe working, then you can make that decision and say, okay, I'm not going to have the ice cream today. Right?
So what's the maintenance program? Is it just, I guess, conscientiously making those decisions afterwards once I go through therapy with y'all? And is the maintenance me writing stuff down? What's the maintenance on it?
It depends on your homework.
Yeah. So everybody goes home with homework, right?
Yeah.
It's not a one and done. You're not going to come in and everything's magical and you're fixed and all of this. You come in, we teach you things, then we send you home. Hey, go do some homework, right? Re-engage into normal life, your life, right? Because when you're in therapy, you're in a bubble.
Yeah.
And it's safe and your brain is doing well and you're getting sleep and all of this. So now you go home. You reacclimate. How is it working there? Here's some homework. I need you to do some of these things, daily for a while, right? And then you're going to see improvements continue. And then you're going to reach this plateau. And you're going to call and say, hey, doc, I think I'm kind of at a plateau. Maybe I need to come back for a bit, right? So you just come in for a short refresher. We get things activating again. Then you start to see those benefits again, right? Okay.
So there's a couple of things out there, I guess, through the different phases, the different seasons of my life, right? Yes, I'm old. We do the whole motivation thing. You got to get motivated to work out. You put the posters up and listen to all the stuff before you get in there. You have all the stuff going for you. And there's a big drive about you don't need to stay motivated. You need to stay disciplined. And if you have discipline to get up every morning at 4 and then go work out, or if you have discipline to not eat the extra donuts or whatever it is, I love it. But if you keep yourself disciplined, is that going to help things, I guess, to keep me out of that injured zone or that traumatic zone or that repair? Or can I get into the repair zone easier?
The one caveat I want to say about discipline is that there's a very big difference in between discipline and perfectionism. I think a lot of people relate discipline to and put this overwhelming amount of stress on themselves to say that I am disciplined and I will do this and then they falter and then they go in through this negative spiraling that is actually part of a brain injury. It's called perseveration and means you have the Rolodex or a hamster in a wheel going over and over and over and over thinking about I messed up. So I think that is really important to discern in between discipline, perfectionism, and then when to give yourself grace and allow yourself to say, well, I wasn't perfect, but I am doing a good job. So
That's pretty interesting. Do you actually talk about that, like in your all's therapies or when you bring people in?
yeah,
Because that's huge for us. I know that, and Johnny's sitting in the studio with us, and he coming from the team background. I remember when I went to the team on the department, and one of our requirements is, as far as marksmanship on all the weapons that you were issued, you had to maintain a minimum of a 90% proficiency. But 90 is not the mark. It's like if you're not at 99 or 100, like people are going to look at you like, really, 96? That's it? And it's always that. So do y'all talk about that, and how big of an impact does that have when you talk about perfectionism and giving yourself grace? Because that's a huge thing.
yeah, day 3.
Yeah.
Really? Wow.
So it is one of the things, right? And like I said, going back to the nutrition thing, you're going to have that one day when you're in therapy and you're like, I'm not going to eat today. I want to see if it really makes a difference. And then you see that it does, right? The motto that we use, or the things that we say, this is just one bad day, right? It's not like you're never going to have a bad day again. You're going to have a bad day, but you need to understand that that's today. And it's okay that today is a bad day, but don't take it into tomorrow, right? Tomorrow is a new day. Get up, get your stuff done, right? Get done what you need to get done. But if you're just really dragging, you've gone 4 days and you've only slept 3 hours, and you oversleep or sleep in on Thursday, it's okay that you slept in, right? It's okay. On Friday, get back on track, get done what you need to get done, right? So grace is something that high drive individuals don't give themselves much of, right? Because if I gave myself grace, I wouldn't be where I'm at. So I can't give myself grace. I got to keep going here. But then there has to be a time where you get to, and maybe that's season and age coming in, but you have to get to a point that you're like, hey, I'm great 6 days a week, 1 day a week, I'm a sloth. All right, it is what it is, right? I'm going to give myself grace to have downtime today, right? And that looks a little different for everyone, right? I after my head injury, I'm just a very extrovert, right? I'm out there, I'm doing. I'm sleeping 3 hours a night. Anything more than that to me was a waste of time. I can sleep when I'm dead, right? And so after this brain injury, I was like, all right, well, that's not working out so well for me now, because now my brain's telling me, no, you better get some sleep. Because if you don't, this is what transpires, right? So then I can either go, yep, this one day, or the next 4 days are going to be crap, right? So I had to learn grace. It wasn't something inherently I was good at, because I was high drive and I was getting it done, right? And so by learning that, it helped me to help patients when they are experiencing this challenge, because it was truly a challenge for me.
Huh. So a couple of other things I wanted to touch on. Sebastian Junger wrote a book, Tribe. It's called Tribe. And he talks about that whole tribe mentality and having a sense of purpose. Man, I just lost my cameras again. Wow. I don't know what's going on with those cameras. I'm going to have to find out who reset them. One more reset.
His name was Johnny.
Oh my gosh.
It's very sus that has
Yeah,
a wire connecting
I
that
ain't
way.
even thinking about that. Really. No, it's got nothing to do with
I'm
it.
just kidding, I'm kidding.
You're better than that. Shut up, Charlie. Damn it, she's probably might have just proved it right.
All right, so the book I was talking about, they were Sebastian Junger talks about the tribe mentality and having a sense of purpose. And obviously, if you're dealing with first responders and you're dealing with military guys, different team groups coming back, everybody's got duties. Everybody's got a sense of responsibility. Everybody's got a sense of purpose in their groups.
Mm-hmm.
So what are you finding? What are you finding? It's like constant obstacles. What are you finding, or do you guys talk about? Like, do you guys talk about that particular thing, that sense of purpose, and do you see that has a big impact on people?
Huge. So the people that come in that still have a sense of purpose, and that have been able to transition that from their military service into home life, or now that they've retired from being a first responder, that's where the biggest challenge comes in, is finding new purpose. The guys that are still active, still working every day, those guys still have purpose. They just have to also have purpose at home, because you guys are high drivers. You do great with purpose at work.
Yeah.
But what is your purpose at home, right? And so those with purpose, working brain injuries with them, it's fairly easy, right? They have purpose. If you don't, those are the ones that are a little more challenging. You have to have a purpose to get up during the day, right? If you have no purpose, waking up in the morning isn't something you even care to do, right?
Huh.
I'll get up at noon, I'll get up at 4.
Yeah.
What do I have to do? So having you guys go through with what we call a battle buddy, not having you in the clinic by yourself. They're battle buddies. We've seen amazing friendships. And we saw one guy out of California picked up and moved to, I think it was North Carolina, to be with the battle buddy that he met in therapy, and they started a business together, right? So those friendships are beautiful to watch them, but you need a battle buddy in there, and those battle buddies help if someone is with purpose and someone is without. You have to have it. As humans, we have to have a purpose to be here every day.
Okay. So, and I think that's one of the obvious things. It's one of the obvious important things. How do y'all use that? How do y'all use that as therapy? How do you use it as a stressor? How do you reprogram these guys to start thinking about, like, hey, start creating a new purpose in your life, creating a new purpose in your family or in your community? I had an episode here recently where I sat down and talked to a couple of ex-Green Berets. And one of the things about team guys is, and the Green Berets especially, their original mission was to set up communities and to help strengthen communities around the world. And I asked them, I said, do you guys find yourselves setting up communities now? Like, now you guys have left the Army and you go take your kids to school. Do you find you're setting up communities there? Do you find you're setting up communities at the golf course? And I said, yeah, we didn't think about it that way, but yeah, I guess that's what we're doing. We'll have a sit down over a beer and then do a first aid class. And it's like, yeah, that makes sense. So do you guys push that kind of therapy for them, or hey, start thinking about doing this at home? Is it important?
Absolutely. And a lot of the organizations, that we deal with, like Defenders of Freedom and Coast to Coast, those guys all have group outings, right? They make sure that guys are getting together and having an opportunity to, one, be able to be with others in their group, but two, having conversation and helping people find those purposes, right? That transition period seems to be a big challenge. You're going from having worked at the same, job, police force for 25 years, and now you're transitioning out of that, not truly into retirement, but you're looking for the next, what am I going to do now kind of thing. Or, you're active duty and now you're transitioning into as a veteran, right? That transition stage seems to be hard. So it is something that comes up in every conversation with every guy going through. What is your purpose? What are you doing when you leave here? What is it that you're changing? What is it that you're keeping the same? What is it that you're going to do? Because that has to be part of it, right?
One of the other things that we try to do very well of to help this aspect of motivation and all these things that aren't very tangible, they're not tangible, is we try to create an atmosphere of a lot of laughter and a lot of joy, and trying to do the therapies in a way that it's not doom and gloom. I mean, keep in mind, if you're rewiring a brain and you're doing it in a very negative connotation, you're going to also absorb that. So one of the things that we do is, as we have these because it's 2.5 hours, or 2 hours per person. There's a lot to talk about when you are doing therapies. When we're having these conversations, we're still also, and I think Johnny can attest to this, we're still trying to find an aspect of laughter or some sort of joy to bring in to that therapy as well.
Yeah. So real quick, you mentioned Defenders of Freedom and Coast to Coast. So I don't want to let the episode go by without talking about them. So Defenders of Freedom, they're the ones that let us use their office. We're actually recording in their office right now. So huge thank you to them, because just having the space available makes it a little bit easier for us getting together with you guys. But groups like Coast to Coast and Defenders of Freedom, they're out there and actually working to make these therapies available, because a lot of people just don't know how to get to. Some people just don't know how to get to the therapy, don't know that therapy exists. Exactly. And some people can't afford to get there, so those groups are actually sending people to you all. They're sponsoring these trips, and that's a huge thing. And y'all talked about, you mentioned like they have these get-togethers, these yearly get-togethers, and it's a coast-to-coast trip on the motorcycles, or it's a gathering here, or it's a barbecue there. Those things are important, and I know they're important because I was a part of all of those things for a long time. And I found that one of the problems that popped up that I noticed in my marriage was I stopped going to those things. And I was like, okay, I lost a little bit of that connection, a little bit of a sense of purpose there. Um, but how important are those things for the guys to show up to? Because I think I think in the end, I have some friends that run a different podcast, and they say, man, it's all veterans on that podcast. And I sat in with them one night, and they have a live session, and the board just lights up. We're watching the Facebook feed, and the board is just so alive, and they're all just typing messages in. Hey, I'm still here. Hey, what are y'all doing? Hey, did anybody go to this thing? And I ended up on the phone with a guy who was just kind of lost that day, and it was a different connection. But they talk about the guys that are out there saying, hey, the 22 veterans a day, I'm gonna get my rucksack on. I'm gonna march to raise money for this, and I think that's all important. But their message is it's probably better, instead of spending so much time doing this, that you pick up the phone and call a couple of people every day and just touch base with them. Do you find that those things are more important to the guys, especially like us after we leave the profession that we were in for so long? What actually brought us meaning and purpose? How important is that?
Community is huge.
Yeah.
And you can think about it in two ways. You're either isolating or you're in community. And so when you do have that sense of camaraderie again, that you have in accountability, keep in mind too, we're not always the best at pointing things out about ourselves.
Right.
When you have someone else too that can spur you into the right direction. I mean, you guys are very familiar with iron sharpens iron. It's just a good recipe for success.
So one of the things I want to bring up, and we had an incident at the clinic. We had one of the veterans had flown in from a very northern state where there's, miles between each neighbor and, wide open lands. And so his thought process on life is a little different than living in Dallas where, we lock doors and, have those kinds of issues. Mm-hmm. So he was actually driving, and our previous clinic was in not such a great part of town. So he was driving to the clinic, didn't have the doors in the car locked, and pulled up at a light. Some guy with a knife jumps in. There is a physical altercation. That person is then ejected out of his car, and he drives to the clinic. And he gets there, and he's fairly wound up. And I'm like, whoa, okay. We're not going to get a whole lot of good brain therapy going on today. First, we got to get him winding down. Yeah. So one of the guys that had previously come through the clinic, I called him because I know he's local. And I said, hey, would you mind come hanging out with us today? He's like, no, what do you need? And I said, this is kind of the situation. He was out of his house in less than 5 minutes, and he was at that clinic. And he sat with that veteran. They talked for about an hour. He got to a point, and, he came over to me, and he's like, all right, doc, he's good to go. He's ready for therapy, right? So that battle buddy system, huge. Knowing that I could call on someone who, one, has been through the program already, and two, was just ready to be there and to be a battle buddy. Drop everything, come on over, let me help out a friend, right? Wow. They didn't know each other. They'd never met before.
Yeah.
And it was there. So to me, these outings are great because they get to see each other once a year and say, hey, man, how's it going? But the check-ins that we see going on, like, with our program, we do check-ins for the next year. We're going to call you, and, we're checking in weekly, bi-weekly, bi-monthly, that kind of thing. And they say, hey, I talked to Sam the other day, and Sam and you were in the clinic at the same time. You didn't know each other before, but now you do, right? So I talked to Sam the other day, and we're heading out to we're going hunting. We're going to go do this. So just those check-ins. They're in two different parts of the country, right? But they're still checking in on each other every day. That's hey, huge. Man, I just really fell off. Haven't been doing my homework. Hadn't done this. Sam called me the other day. He's my accountability guy, man. I'm back on. I'm doing my stuff like I'm supposed to, doc. All right, good to go, So it's one thing coming for me. I'm calling to check on you. But when your accountability battle buddy calls you, you get your shit together, right? Yeah. You do the things that you need to do.
Yeah, that's huge. That's important. So we're just over an hour, and I know we've covered a lot. So what is it that we're not hitting? What are some things that you guys want to hit before we get out of here, or some closing thoughts that you want to really tie up before we leave?
Wow. So I guess if I had to throw something out there is that, you know, it's a lot harder to have a brain injury when you're not missing a limb. And there could be someone listening to this wondering, you know, do I have a brain injury? Do I qualify as someone that may have had a brain injury? And they could probably listen to most of it and say, okay, I can relate to that. I can relate to the Rolodex, or I can relate to the impulsivity. I can relate to maybe the hormones aspect of it. And I guess if you're that person and you're in doubt, the best way to find out is just to reach out to someone and try to start consulting and seeing, you know, is this something for me or not? And so that would be the best thing that I could say, because it can be a very difficult process to look in the mirror and you're having that conversation with yourself every single day. Well, I look normal, so I don't have an injury. And something happens and you're like, I may have an injury, but I look normal, but I don't have a brain injury. So just reach out to someone and try to figure that out.
Okay, so let's real quick. Tell me again, what's the name of your all's clinic?
Resiliency Brain Health.
Resiliency Brain Health, and that's in Capel, Texas?
Yes.
Or is it Coppell?
Yes.
Both. All right.
Depends on who you ask.
So what you're saying, reach out to somebody. Do y'all have a system in place at your clinic to where if I want to reach out and I actually want to talk to somebody, do y'all have a list of people that are willing to talk to me? Like I can call and you can say, hey, look, here's Johnny's number. Call Johnny. He's been here. He's been a patient of ours, and he'll be happy to talk to you about this.
I can't do that because of HIPAA.
Right.
That's where we're. So if it's a veteran or a first responder, what I do, however, is say, hey, listen, you know, because if you call me and tell me you're a veteran or a first responder, I say, hey, listen, I've got a couple of groups of people. I'd like you to reach out to them. And then I do give them Johnny's name, or I give them Donna with Defenders of Freedom's name, or whatever the organization is. Okay. And if if that person doesn't fit within the mission statement of, special operator or post 9/11 combat or whatever, Donna and Johnny say, hey, they're not within my mission, but I sent them over to this place, right? So we try to find a person or a place or someone to talk to them, right? We're not just leaving you hanging. We want to make sure that we get you to a group, and then that group, now Donna and Johnny can let them talk to whoever, right? Because it's not a HIPAA issue. They can say, hey, John, would you call Sam because he's thinking about coming into the clinic, right?
That's awesome.
And so, or they send some information or whatever it is. So we have that system in place. Unfortunately, the medical system,
Yeah, and that's huge. And I didn't even think about the aspect of those groups or those foundations being able to provide that connection. And that's awesome. But you mentioned something. You said if you're not missing a limb. So how real are those treatments, or how impactful, or how real is phantom pain? Because we talk about the guys that are missing limbs, and it's like, man, I still have that itch down on my foot. There's not a foot there anymore. Mm-hmm. So how real is that?
Very real.
Yeah.
How do y'all treat it?
Well, there's a doctor, Johnny, right? Just wanted to say his name, right? But anyway, he was the brain child behind mirror neuron therapy, right? And that's where mirror neuron therapy actually came in, was treating amputees with phantom pain, right? So there's a lot of different types of therapies out there. It's one of them that we use in the clinic, but we use it for many other things, right? Mm-hmm. Stroke patients that have, are paralyzed on one side, we can use mirror therapy to help them start to be able to move those limbs and things again. So it has a lot. The guys and gals that have missing areas, right? If they have a missing limb or such, people look at them and say, yeah, in fact, this person's injured. I can see they're injured. And if you say, hey, man, I lost my arm and I have a brain injury, it's not a far reach. People are like, yeah, that makes sense. Mm-hmm. The problem is when you have all your limbs and people look at you and say, well, you don't appear to have anything. You go to work every day. It can't be that bad. Mm-hmm. And that's not the truth at all. Oh. And so those are the often forgotten groups of people that we see, right? Yeah. Because that's not who everybody wants to put on their poster, right? They want to put the guy that you visually see. And I understand that. I'm not saying anything negative about that. But the guy standing there that looks like he's got it all, nobody wants him on the poster. Yet he is the person that has already said to me 3 times, I know Donna and Johnny want to get me in, but man, this guy needs it more.
Mm-hmm.
And every one of them say, but this guy needs it more, right? And so the one thing I want to make sure people know is it's not that they don't need it, but it doesn't mean you don't need it, right?
Right.
And so just because you think your friend is struggling, the funny thing is your friend already called me and told me you were struggling. He told me you needed this more, right? And so we get to hear these conversations like at some of the outings that we've been to. Man, this guy, he needs to get in before me, right? And so if you're struggling, it's you deserve it as much as anyone else. If your brain is injured, you deserve it to get help. It's not that anyone deserves it more than you.
One quick tidbit, just for anyone that is wondering, no, you do not need to have loss of consciousness to be able to have a brain injury. So you do not need to lose consciousness to have a brain injury, and you do not need to be disoriented for a prolonged amount of time to also qualify to have a brain injury. So this is why this is very tricky.
Yeah. I appreciate you throwing that in, because that's a huge thing for us. It's like we're very black and white. I've got to be able to feel something. And that's cool to throw that in there, because it makes it easier for us to comprehend it on the opposite side, the guy brain and all. It's I need to see it, right? I'm a visual learner. What are the qualifiers? Like, how can I come in? It's like, yeah, you know what? Years of flashbangs going off around us, and time on the range, and tinnitus and everything else. What are the qualifiers? Can I say, hey, look, I've been through so many flashbangs throughout my life, and now I'm having trouble getting along with the guys at work, or man, me and my girlfriend are fighting all the time about this one particular thing. Does that qualify? Is that something that I need to pay attention to?
If it disrupts your life, it is something you pay attention to, right?
Okay.
So if you called and said, man, I just don't know. I'm going to send you some paperwork, right? The thing everybody loves, paperwork. But I'm going to send you some stuff, and I'm going to look at it. Dr. Eisman and I are going to go through it. We do what's called a medical review, right? We look at everything that you send to us. Unlike a lot of doctors, we actually look at all the stuff you send to us, all right? And so if we look at this and say, hey, man, there's a couple more questions I have. I may send you something else. But by the time you come in, I have a really good picture with that paperwork of where you're at. So if I think after looking at all of this that I can help you, I'm going to call you and say, hey, listen, let's get you in, let's do a consult, let's see what's going on. If I think I can't help you, I'm going to call you and say, hey, listen, I don't think I'm the right person for you, but here are 2 or 3 other people or other professions that I think can help you. Let's see if we can explore that, right? Or I'm going to say, I think I can, but I think you need to do this first, okay? So before any of the veterans or first responders come into the clinic, we have labs on them, right? We need to know what that chemistry looks like. Because if I can get your inflammation numbers going down before you even get there, then rehab, your brain rehab goes faster, right? It's not that I can't do it after, but if I can do it before, why wouldn't I, right? So that's it. It's really about, not so much about qualifying, it's what are you experiencing? What is your job, right? Does your job predispose you to some of this, which it does, right? If you're a first responder in the military. And a brain injury can be many things. It can be chemical. We know that. People OD on drugs all the time, prescribed and not prescribed, right? It can be vascular. It's called a stroke, right? Vascular injury. It can be a trauma. You didn't have to roll over in a Humvee, right? You could have had one of those hard landings or hard repelling landings, right? Or it can be having things blown up beside you over and over and over, and it's a blast injury. So there are many ways to get a brain injury. It's not everybody had to play football and get knocked out on the field, right? And
That's
all
huge,
of those things add up. The problem is, if you're in a high inflammatory state when you get that injury, and then you're eating MREs and all this other crap that's inflammatory, you can create another brain injury because this one hasn't healed, and now you're chemically creating another one on top of it. Does that make sense?
Absolutely.
So this is how you get this sequela of issue, because now people are like, well, man, I really had this really bad accident, and now I just bumped my head the other day, and I feel so much worse than I did after this. Well, this one never healed, and now we're in a high state of inflammation, and you hit it again, and it seems like this should be benign, but it's not, because you're still dealing with this one, right? And
Yeah.
so that's how we get to the state of where we are.
All right. So for the show notes, I'm going to have to define sequela and perseveration, right? And spell them out for everybody. I don't know what the hell those things mean. But
Sequela means you've had multiples
Mhm.
without that healing.
okay.
So if you just had the one injury and it heals, you're great. If you had this injury and a day or two later, which isn't uncommon, right? You had this trauma and then you're kind of disoriented and off balance, and then 2 days later you hit your head again, and then 2 days later you hit your head again. Now it's a sequela. The first one didn't heal. The second one hasn't had a chance to heal. We're only days. And now we've had a third one.
Mhm.
So that's a sequela.
That's huge. I'm glad you explained that, because I know that there's a lot of guys out there that have gone through that didn't know what the hell they did.
Mhm.
But maybe we can get them in to see you guys. So I want to get to wrapping this up, but
Mhm.
before we leave, I want to ask you a simple but important question. Well, I forget. If I come to therapy,
Mhm.
will there be mofongo available? And I don't know what the hell's in it, but I just loved ordering that. When I was in San Juan, I had to go order mofongo in like every restaurant, 'cause I just loved saying it.
If you do come to therapy, I will provide a mofongo.
Yes.
That's
All
normal.
right.
That
So
was
you
fun.
guys have helped a lot of people throughout your career. And they're going to turn around and they're going to make a movie. Hollywood's going to call them. They're going to make a movie. Who's going to play y'all?
What?
When Hollywood makes the movie about you two,
I don't think I've ever thought about this before. I know who-
Nerdy pocket protector. Yeah, no, that's
even
not
better,
me.
even better. You tell me who would play her.
I know who would
Tell me.
play her.
Tell
Kate,
me.
Kate Middleton.
Oh my God, no! What?
No?
I like that.
I've never seen Kate Middleton on a motorcycle. What the heck are you talking about?
All right. That's good.
Oh my God! I don't know.
I mean, if I had to choose.
Don't choose her. Did I mention my head traumas came from motorcycles?
Oh, no. All right.
Gosh, what's the? I
Dude.
forgot the name of this gal. I forgot the name of this gal. She's, Star Wars.
I'm gonna go with Gal Gadot because it's close to mine.
Oh, I
Charlene
like that,
Godet.
yeah.
I do like Gal Gadot.
Daisy something?
No, I'm talking about episodes 1, 2, and 3. I'm talking about Padme. Can't remember her name right now.
Oh my. Okay.
All right.
I'm trying to think, man. I'm not doing well with this one.
I like that. I like to throw people off a little bit.
That really threw me off.
All right.
Yeah. Some Star Wars nerd is probably listening to it saying the
Padme.
name. Yeah.
They're
I'm a
they're
nerd too. I'm not dissing you.
All right. Cool. Anything else y'all want to hit before we go?
Last tidbit to reiterate what she said. No, in fact, you do not need a physical blow to the head to qualify to have a brain injury.
That's huge.
Blast injuries are huge.
Yeah.
Cool. Thank you all for being here.
Thank you, sir.
That's funny. I was like,